Thank you so much for having me.
No, thanks for being here. Do you want to share with everybody a little bit about your background and what you do?
Yes, so I'm Dr. Raquel. I am the Naturopathic Medicine Expert at the Center for Reproductive Health and Gynecology. I went to school for naturopathic medicine at Bastyr University in San Diego. And so, naturopathic medicine, a lot of people, whenever I say naturopathic medicine, people say, oh, like functional medicine, but it's the reverse. So, functional medicine was birthed from MDs who wanted to learn what naturopathic doctors do and incorporate it into their practice. So we all believe that, just like Riley just said, that health is multidimensional. And in order to understand any disease, whether it
Yeah.
be diabetes, anything, and all the way down to fertility, you always want to look at the root cause. So I specialize in helping women who are suffering with subfertility or infertility look at the root cause of their symptoms.
That's incredible. I don't think that I really understood the difference between the functional medicine piece of this and the naturopathic piece. So it's awesome.
Yeah.
So we have a ton of questions. I know you hopefully you have a lot of answers for us.
Yeah.
But for everybody on kind of a discussion point, I wanted to share with you and talk to you about, and just kind of get your feedback on. This says fertility is one of those things that you don't worry about until suddenly you do. Does Dr. Raquel think that we should make fertility a more common conversation to prevent stigmas and help educate women? And how does she think we could go about doing that? Struggling with fertility is a lonely and scary place. We feel as women it should just happen, and when it doesn't, we stress that we aren't succeeding at the basics of being a woman. It rocks people to the core. Then no one talks about their struggles, and people feel very alone. And yet, when I feel like almost every mom I know had to get at least a little intervention to conceive, it's really too bad we all don't know more about it. I think going through this with other people helps you feel not so alone.
I love that. That is perfect because that is so common among my, not only my patients but my very close friends. It's something that we don't talk about, and to me, I think we don't talk about it because it makes us feel less than, right? When the reality is, in my opinion, when you are dealing with a struggle or a mountain of any kind, to me it makes you stronger to say that I can't do this by myself.
Right.
Whenever you can overcome any battle, to me that makes you stronger. That makes you, more of a woman, more of someone who knows, like, I can ask for help and I can, gain strength from other women going through the same thing, because the reality is it is way more common than like, so many women that you would never imagine have dealt with these things, but like she said in her question, it's almost like a stigma because we believe, oh, my sister, she just got pregnant, or my cousin, she just got pregnant. She just, she has babies all the time. She has no struggles. When in reality, you never know what people are going through behind the scenes, and you using your voice, it could save someone else to say, you know what, me too. Like, I'm also having a hard time with this. Like, I thought I was alone. So to me, your question alone is power, and it gives so many other women strength too.
So this is really a thing that we just don't talk about, because I feel like from high school and all these events, it's is on the
Yeah.
protection. They make it sound
Hmm.
like it's so easy also to get pregnant. So I feel like that may be misleading a little bit.
Absolutely. I feel like growing up, like you said, we're 16, 17. It's like, don't get pregnant, don't get pregnant, use
Yes.
protection, take birth control, don't get pregnant. And then you hit 25 and it's like, why aren't you pregnant? I want
Right.
grandkids. I want, so it's like that quick switch that we're like, wait, you told me not to get pregnant, but now you're telling me to get pregnant. So I really believe that what happens is, the reason why people don't talk about it is because we have always, they call it like a self-fulfilling prophecy, right? It's something that
Hmm.
you believe to be true. And so when life kind of shows you the reverse of, like, uh-oh, this might be harder, it kind of knocks down everything you ever believed about womanhood, motherhood,
Right.
pregnancy. So you have to kind of make your own definitions of what that looks like for you.
What do you think we could do to really change this from it's so easy as a woman to get pregnant, this is just what we do, to hey, reality is we're complicated humans, and it maybe there's it and are there more people in this situation that we actually know of?
Yes, absolutely. I think platforms just like yours, Riley, just like Sophia Health, there are so many more platforms making this, like, breaking this stigma, right? Because the reality is there's about 6.1 million couples in the United States alone that suffer with infertility. That's a
Mm.
lot of people. And it was even this, one of my patients sent me this, like one of her favorite YouTube personalities came out with her infertility story. And she was just like, oh my God, it's not just me. And so to me, the way that we get away from that, it's something wrong with me. I'm abnormal. I'm doing something wrong. The way we get out of that is to have more conversations and to not be afraid to really use your voice. Yeah.
And that's what we're doing. I mean,
Mhm.
I know Sophia Health doesn't focus specifically on this piece of it, but as a naturopathic doctor, I want to make sure people have access to care and know that they don't just have to go to certain treatments or straight to the doctor, that there's
Yep.
all these practitioners available to help you with life and
Yeah.
everything that goes on.
Yeah. Absolutely.
So
Yeah.
I hope we can use our voice and change that. We're trying. We'll get
I know.
there.
I know this is the first step. This is such a good step. So I really love that you're doing this. This is awesome.
So if you want to jump into the questions, we
Okay.
have a lot.
I know.
Um,
We have a lot of questions.
uh, I'm trying to conceive my second baby at 40. How can I increase my odds as an older mom? What is different about fertility for an older mom?
Yes. So I saw that question. So when I heard that, it made me think of something I learned when I was still in medical school. And one thing that one of my favorite supervisors told me was that it's not your age, it's the quality of your eggs. Right. So we learned that as women, when you hit about, I think the age is like 35 is when so how it works is that you're born, women anyway, we're born, we have all these eggs, and then when we turn 30, 35, the eggs kind of like drop off. And so what
Hmm.
happens is men continuously produce sperm, right? They always get new sperm. That's why like older men can always have babies. But with women, we tend to lose our eggs, or the quality of our eggs kind of diminish with age. And so what I learned in school was that more than focusing on I'm 40, I'm too old to have a baby, instead you want to think about what am I doing to make sure the quality of my eggs is up to par. And one very important thing to make sure that your eggs are really good quality is to make sure you're getting those micronutrients from foods. So antioxidants are very important because they help to protect the chromosomes that make up your eggs and sperm as well. So you want to make sure that you're eating like an antioxidant rich diet. That's a really, really good first step to make sure you're protecting your health, the health of your eggs as you age.
If you're not always on that antioxidant rich diet, is there a
Mhm.
way to start? Or is it too late to start? Or is there a point of no return?
Well, that's a really good question. So, a really good marker that we use at our office is a test called your AMH. So,
Okay.
whenever you go to a fertility practice, that's what they're always going to do. They're going to take your day 3 labs, and then they're also going to test your AMH. That number looked at how many eggs you have left in reserve. And going along with that marker is a marker called inhibin B. So that's going to tell you how many eggs you have left is AMH, and then the quality of those eggs is inhibin B. So once you know that marker and you have this number, now you can do the work to improve the quality of those eggs. Now, sometimes
Got it.
there are going to be variant factors that can affect you. But I always tell women to get the facts first, because you never know. You can't say
Yeah.
because I'm 40, my egg quality is bad. I literally had a patient today who was 40 and had 17 or 18 eggs. So to me, it's not your age, it's your egg quality. And so again, having an antioxidant rich diet, consuming a really good high protein diet, really good vegetables, healthy fats, and really good supplements like DHEA and CoQ are really good places to start.
That's amazing.
Yeah.
Just having that information, I feel like that alone breaks down so many barriers.
Yeah.
Why do we have this 35 or 40 biological clock ticking when it's just the health of your body and the
It's
quality of your eggs?
honestly, it's kind of like, I remember when I was growing up and I was younger, I was like, fat is so bad. Don't eat fat. It's so bad for you. And now everybody's like, oh, actually, fat isn't bad. You should be eating healthy fats. Like, it's actually really good for you. To me, what happens is we go through life believing one thing until somebody
Yep.
makes it, until somebody like lifts the veil and you're like, oh my God, like, wait,
Yep.
what? And to me, that's even how I started my job with fertility, is because I was doing research and there was a doctor looking at women with premature ovarian failure, and they were like 25 or 26. And what was wrong, it wasn't that they did not have healthy egg quality or they weren't producing enough eggs, but they had been exposed to heavy metals. And so that
Oh,
affected the number of eggs they produced. But once we removed the heavy metals from their system, they produced all the eggs they needed. So to me, it's just a matter of having information about your body. That's what changes the game, is like, this is my body. Let me learn as much as I can about it.
That's incredible. I feel like you have lifted the veil on this, even for me. And now I know to maybe get a baseline check first and like what to even check for. So
absolutely.
There's just so much information online. So sometimes it's hard to parse the information and where do you get started? That's what we're doing on our platform, is trying to help with that. But
yeah,
this is incredible.
Yeah.
Okay. Most women today have been on the pill for 10 to 15 plus years. Should we be concerned still being on oral contraception in our 30s, or should we switch to an IUD?
Such a good question. And that was actually another one of our questions too, was birth control versus IUD. So it varies. It always varies by patient. So some patients are able to take birth control for 16 years, ever since they were in high school, and then they stop and they immediately get pregnant. Whereas some women take birth control for a long period of time and it affects their fertility. What we found from research and from experience is that what happens is that birth control depletes you of your micronutrients. So even if you're taking birth control, you want to make sure that you're also kind of giving your body what it needs. So making sure you're taking a really good B complex, a really good like vitamin C, making sure you're giving your body what it needs to kind of replenish what birth control is taking away. So sometimes it's not a matter of the birth control causing you too much harm. It's just making sure you're giving your body the nutrients that it might be taking away.
Are there tests for that?
So
your doctor can get those?
Yeah, so I actually use Genova, and what I do for my patients as a first step is baseline. And when I look at the baseline, I'm looking at any micronutrients that you might be deficient in. I look at your micronutrients, your gut function, and then heavy metal exposure. That's always my first step.
When you're young and you go on birth control, I don't feel like your doctor tells you, hey, make sure you come back for blood work, make sure you're getting all the nutrients your body actually needs.
Yeah, no, they're not going to ask. They're not going to say that.
Okay.
Only because it's the way things have always been. Like all of this stuff is like new. I know like Dr. Mark Hyman is like huge in the functional medicine world. And so to me, he's kind of one of the champions of this revolution of like, no, it's not just what we've always known about medicine. There are other things that are factors in your health. So I love things like that because it helps to kind of walk us away from that stigma,
Same. Love what he's doing. Why does secondary infertility happen? How can you avoid it? If my first pregnancy was healthy with an uncomplicated delivery, should I be concerned?
Yes. So secondary infertility is actually more traumatizing sometimes. I won't take away from primary infertility or just normal infertility, but secondary infertility can be so harmful to the psyche because you've already done this, right? It's like, I have been pregnant. I had 2 healthy pregnancies, or I had a healthy pregnancy and nothing was wrong. And now me and my husband have been trying for 2 years or 3 years or whatever the case may be. So to me, sometimes it's mentally more taxing because you have been in those shoes before and you know how to do it. But some of the main causes of secondary infertility is going to be the man. And so many times women tend to blame themselves. Like we hear it all the time at our office. It's like, well, it can't be my husband because he has kids before me, or it can't be him but men tend to either, expose their testicles to very warm environments, or they might be smokers, or they might drink a lot. And all of that affects the quality of the sperm. So all this time you might be blaming yourself, when in reality, it could be your partner's sperm. Or male fertility is one of the top reasons why secondary infertility persists. And then the second being problems with ovulation. So sometimes after you conceive and you have a healthy pregnancy, you could have like irregular ovulation or no ovulation at all. And then the last thing is going to be problems with your tube. So sometimes when you conceive, you could get some scar tissue that is left behind either in your uterus or your fallopian tubes, and that could affect a healthy pregnancy too. So I always recommend when you have secondary infertility, just getting that full workup by a fertility specialist.
What are my alternatives if my doctor is suggesting Clomid to help with ovulation?
Yeah, see, that's a really, really good question, actually, because a lot of people use Clomid, especially women who have PCOS, because women with PCOS actually have irregular menses, which if your menstrual cycle is irregular, it affects your ovulation. So Clomid is actually used to trigger your body to ovulate. And I always make sure that when it comes to fertility terms, sometimes it's like, wait, what are you
Yep.
even talking about?
Yeah.
Like,
Yeah.
so I like to like take a step back to kind of
Please.
explain like, okay, good. All right. Because sometimes it's just like FSH, estrogen, ovulation, like, wait. So when I say ovulation, what I mean is when we as women, when we get our period, the first day we bleed, that is day 1 of your cycle. So that's day 1.
Okay.
So at the beginning of your cycle, what your body is doing is it's maturing a follicle or maturing an egg to be released. So what's happening is as you go throughout your cycle, you get to day 14, that's ovulation. And at ovulation, the follicle gets so big and this egg literally protrudes from that follicle. And that's the maximum time that you can get pregnant. It's because an egg is being released to hopefully meet with sperm. So when you ovulate, it helps to increase your chances of meeting with sperm and getting pregnant. So that's why they give Clomid to women, because it kind of improves your odds of pregnancy. So what I typically recommend, if you have regular cycles and you're being seen by a physician, I recommend knowing your fertile window. So if you know, okay, the first day that I bled was June 1st, then you know that your ovulation day might be June 14th. So your fertile window is going to be June 12th, 13th, and 14th. So I always tell women to try to be the most sexually active during those days. Rather than just day 14, you want to make sure you're having sex around those days so that you're kind of maximizing your chances of conception.
Tracking it is just a really good option too. Just being very clear on the window.
Mm-hmm. And I know there's like these really cool like bracelets, like Ava women.
Mm-hmm.
There's like all these really cool tracking devices that kind of help you know this is your fertile window. This is when you're ovulating. Have sex with your partner.
Okay. Are there any procedures or medications that my doctor might recommend I should try to avoid if attempting to stay more natural in my conception attempt?
So what most doctors will do, and I'll just speak from the doctor I work with, but a lot of times, if a woman is very young and they're coming in to see him and it's very early, like let's just say they're 25 and they're like, oh my God, my boyfriend hasn't been having sex for 2 or 3 months, he'll literally say, no, you should go home and just have sex.
Yeah.
I will say for sure, Dr. Naj is very honest. He doesn't say, okay, you're here, let's do IVF. A lot of times he'll say, you're letting the internet freak you out. Because sometimes you're just not giving yourself enough time. But a lot of doctors, like especially OBGYNs, if a woman is very young and she just wants to like say, hey, I'm ready to be pregnant now, they will give Clomid as like a first step option because it doesn't have as many side effects as say some of the other fertility drugs.
Does smoking marijuana really affect fertility for both males and females?
That is a hot topic. We literally
Wow. No way.
It is because I don't know, maybe LA, California is like, you know, it's so normal for people, but we literally get that all the time. And unfortunately, the research is conflicting. Some people say marijuana is horrible for you and your partner, and some research does not have enough valid evidence to say that you shouldn't smoke. So what I actually found is that the research is not sufficient enough to say that you shouldn't have it, but they do say in some women it could affect ovulation and lead to miscarriage. And then for men, it tends to affect the quality of the sperm. So they say that smoking, any type of smoking, cigarettes or marijuana, it affects the chromosomes that make up your sperm. So it makes your sperm abnormal.
So what are some basic things that you can do to improve fertility? It says there's no smoking, drinking, healthy weight. What else?
Yes. One of my like key things that I say that I even think was a part of my bio is like the key to a healthy pregnancy is a healthy body. So what I always recommend to my patients first is to just look at your lifestyle now, right? Because when we're younger, it's a little bit easier to make changes. And when we get a little older, it's like, well, no, I'm not going to take away gluten. It's something I've always had. So I always say the first thing is to clean up your diet. And I never give like a very strict diet to my patients. What I typically say, especially if they are doing IVF or IUI, I always say you want to make sure you are limiting your gluten because there is tons of research out that ties gluten to miscarriage. So I always recommend first things first, limiting your gluten, and then making sure that your plate is primarily vegetables, having a very healthy, sustainably sourced protein like salmon, chicken, any type of protein you like, and then having a healthy fat. So to me, however you want that plate to look, you can have it that way, but you want to make sure you have the vegetables, proteins, and fats. And that's first. And then I always recommend getting that baseline profile. Even if you don't have a naturopath, your PCP could even run a quick heavy metal test to just make sure you don't have anything impeding conception, because that could be the key to helping you conceive naturally.
Wow. I mean, this is so helpful.
Yeah.
And it really seems like it's going back to kind of, I don't want to say basics, but it seems kind of
I
affecting.
know.
I thought the biggest things were age. So I was way wrong.
I know. Which, I never want to say like, a lot of women that are like 55 and they have twins, it's like, people are like, oh my God, but they probably got IVF. But sometimes you can never doubt the power of the human body. Like if a woman is healthy, a woman is healthy, period. Like I never go against that. I always say it's the health of your body, not your age. And I believe that.
That's amazing. How detrimental is stress to fertility? What can help? Meditation, massage, etc.
Yes, I love that question too, because I talked about that question a little bit on my Instagram. Here it is, right here. This is a very important point, because what happens is when you're stressed, your body releases adrenaline, which is like your fight or flight hormone. But you have to think about it. I always tell my patients, think about, okay, it's Saturday morning, you're at Runyon, and all of a sudden a bear comes out of the trees to chase you up this mountain. So when this bear is chasing you, your body is not thinking about having a baby. Your body is thinking about protecting you from danger. So what happens when you're stressed, your body doesn't know, am I running from a bear or did I just break up with my boyfriend? So what happens is, like, when you are very stressed and anxious, your body is in fight or flight mode. It can't tell the difference between an immediate threat or something that happened in your workday. So when your body produces adrenaline, it literally tells your reproductive hormones that this is not the ideal time for conception. So whenever we are high stress, our body is literally like, no, girl, this is not the time to have a baby. You are too stressed out. So adrenaline inhibits your reproductive hormones from conception. And that is why, although it's very annoying, that's why so many fertility doctors tell women to, first of all, like, calm down. That's the first step, is to de-stress, because if you're stressed and you're doing IVF, it's just going to fail. It's not going to work, because you are in fight or flight mode. I know they asked me, like, what can really help? And one of the top things that I love to tell my patients is stress is going to come, because it's life. We're in a pandemic right now. So stress is going to come, but I always recommend to change the way you respond to stress, right? So to kind of get those meditation practices or start doing yoga to kind of teach you, like, when I see this stressor, when it comes on, how am I responding to it? Like, how am I letting it ruin my whole day? Or am I giving myself time to say, okay, I feel the emotion and I let it go? So to me, that is such a big step. And that's why meditation and yoga are so important, because they help to, like, ground you to not respond to life. So I definitely recommend, just looking at how you respond to stress.
We're stressed every day. I 100% agree. How you respond is going to make the biggest difference. So
For sure.
What a great question. All the things that can help improve fertility, what items give the biggest bang for your buck? Are there percentages published on how much they can help?
Yeah. So it's so true. Like, sometimes, so I do like these free calls on Saturday mornings with women, and they always ask me about, like, oh, I found this supplement package online for preconception health for $500. What do you think? And then it'll be a whole nother company from another woman. And it's mostly because the things that are online for women and fertility is so overwhelming. I mean, it's everywhere. Fertility is everywhere, and preconception vitamins and fertility vitamins and things you should take. So I always say, to, like you said earlier, stick to the basics. What I always recommend to my friends that are just out of college or out of grad school or just getting married, and they're like, I know I don't want a baby right now, but maybe in the next year, what would you recommend? And I recommend, the first step is to get an analysis. Like, I don't know if you can find a naturopathic doctor or even a medical doctor that practices functional medicine, but I always recommend the first step is looking at your gut function, getting your micronutrient panel and a heavy metal panel, only because I think gut function is so important, because sometimes my patients come to me and they are taking 10 million supplements and their body is not absorbing any of them. And that's because they have been exposed to bacteria or yeast or fungus, and it's just recycling in their gut, and they're always fatigued or they're always anxious or depressed. And a lot of times it's stemming from your gut. So if I would say my first recommendation would be to look into your gut health first.
That's incredible advice. So thank you.
Yeah, of course.
What are your thoughts on acupuncture to help with IVF transfers? Does it work?
I am such a huge fan of acupuncture. Let me just say that. Acupuncture like changed my life. I am such a huge fan of acupuncture. But I wanted to make sure before I even like made my point was to say, number one, I'm a fan, and number two, I'm not an acupuncturist. So I know they know a lot more ways it helps with IVF, but what I've seen from research and from experience is that when women get acupuncture either prior to or during IVF, it's because it helps with the stress response. So what acupuncture does is that it kind of brings down that stress response, because when we're stressed, once again, our vessels tend to do this because we're stressed, and it's like fight or flight. So it's not the time to be pregnant. And so what acupuncture does is it causes those vessels surrounding your reproductive organs to dilate. And so that allows blood flow to get through to the organs. So I know acupuncturists probably know way more, but what I know from research is that it just kind of helps with blood flow to the reproductive organs.
I hit a major energy slump around 2 to 4 in the afternoon. Can you speak to this in connection to hormonal imbalances and possible solutions?
Yes, it can be two things. So the first thing is going to be assessing what did you eat for lunch. So I know a lot of, especially a lot of my patients here, they do intermittent fasting, so they don't do breakfast. But for people that do breakfast, I always tend to ask, what did you eat for lunch? Because if it was a very carbohydrate dense meal where there weren't a lot of nutrients, but more, let's just say like In-N-Out and fries and a Coke, that's probably why you're sleepy, because your body went through this huge insulin spike. And then once it got what it needed, it dropped back off. So number one, it could be food, but for hormonal imbalance, it could be cortisol. So cortisol is like one of our major stress hormones. And what happens is our cortisol should be highest in the morning. So we should wake up like super alert, which I feel like is rare, but we should wake up like ready to take on the day. Let's go for a run. That should be like, that's your cortisol. Like, I'm up. And then cortisol should start really high. And then as the day goes on, it kind of slumps, but it shouldn't drop you off. So what I recommend to women, if you just feel totally exhausted and like, let's say 2 or 3, exhausted to the point that you cannot get through the day, or you're falling asleep at the desk, or you need like 3 venti lattes. At that point, I definitely recommend my favorite is the Dutch hormone test, because it looks into that cortisol marker to see if your cortisol is totally plummeting off. But just feeling a little bit more fatigued is normal, because that's what cortisol should do. It should kind of fall down a little, and at night it should be like non-existent. Whenever women say they can't sleep or they feel wired at night, it's because your cortisol is imbalanced.
I am definitely going to get one of those, because
yes, it's an amazing test. I love it. Yeah.
Again, that was a wonderful question. So thank you for asking that. Okay, if all motile sperm swim slowly, can this lead to taking longer than average to conceive, or are slow swimmers just as likely to make it to the egg?
Slow motility, it can affect how likely your partner is to get pregnant. So what I found in the research was sometimes, which is why it's very important for men to get a sperm analysis, sometimes your slow motility could be because you have a varicocele, which is almost like a varicose vein inside of the testicle. And what that can do is affect how fast the sperm can get out. But a lot of times it's lifestyle factors. So a lot of men either take testosterone for the gym, or they don't eat well, or they're drinking a lot of alcohol. All of those things contribute to slow motility or slow swimmers. In that case, you just, you either get a sperm analysis to make sure you don't have anything impeding it, like a varicocele. And then if it's not, you just want to improve your lifestyle.
If a man has a low sperm test result, what further tests can be done to identify any underlying causes? And would hormone tests make sense?
Right. A major thing. One of my favorite supervisors in med school, Dr. Caviola, he did men's health. And a major thing that happens to men is some doctors test their testosterone at the wrong time of the day. So for men, I always recommend you getting your hormone testing in the morning, first thing in the morning, because testosterone, just like cortisol, is made to be its highest in the morning. So if you go in the afternoon to get your testosterone checked, then it's going to be like, oh my God, your testosterone is so low. Is something wrong with your sperm? When it's really not. You just got it tested at the wrong time. So testosterone for sure is a first, and making sure it's in the morning. And then for your sperm analysis, sometimes, let's say Melissa is our andrologist at our center. If she sees a report that the numbers are just too low, or it's literally zero, no sperm, then Dr. Naj will recommend that man to a urologist to do something that's called a TESE. And that's where it's from what I have heard, I'm not a man, but they have to literally look into the testicle to see what is wrong. So if your numbers are too low, then you'll be referred to a urologist to look further into it.
Sugar craving and emotional eating. Tips and tricks for the hormonal sugar cravings connected to emotional eating.
Yes, I love that question, because once upon a time, I was getting this very, very often from my patients and from just some of the women that follow me on social media. And when it comes to emotional eating, instead of me telling people to say like, buck up and get it together and you're an adult, you shouldn't eat that, I always ask women to look at the root of why you are stress eating or emotional eating. Because people can give you 3 million tips, but if you're not addressing what is really wrong, you're always going to go back to it. So whenever I come across a patient who says like, I can't eat one Oreo, I have to eat the entire thing of Oreos, or I can't have one chip, I have to have the whole bag of chips, I never give extra recommendations except to either start journaling or to seek out counseling. Because to me, it's a trigger. Something triggered you, or there's like this, the common response that I get is this feeling of fear. Rather it be the fear of I can't conceive, or I'm not good enough, or I'm trying this thing, so I must not be a woman. Every other woman can do it and I can't. Like, my biggest thing is to not give people more that they're doing wrong, but to say why. To me, naturopathic medicine is the medicine of why. So why are you stress eating? Why do you feel the need to, consume more than you need? And to me, once you get down to that, you won't have that problem anymore.
Amazing.
Thank you.
What are the best supplements for male and female fertility?
Yes. So for men, it's really, really cool, and also equally annoying, because it's very easy to, it's so easy, and easy is
Relative. Right.
But for male sperm, it only takes a few tweaks to get it back right. If you're taking testosterone from the gym, stop taking testosterone.
Oh, wow.
But I know, so it's like, because they create new sperm every 3 or so months, they create a new batch of sperm. So they stop taking testosterone, and then they have this new perfect sperm. And it's like, okay, great. My eggs can't do that, but okay. So for men, I always recommend to remove that underlying cause. So if there is something that is causing your sperm to be abnormally low, and for sure you're at the gym taking roids or testosterone, stop. But if it's not that, then antioxidant support is huge. So I actually do IV therapy for a lot of men at my office, where I include antioxidants like glutathione, zinc, selenium, and I include these into an IV. So I always recommend for men major antioxidant support, because those antioxidants help to improve the quality of the sperm. So it gets rid of those chromosomal abnormalities. And for women, I recommend really good micronutrient support. So some of the major micronutrients that a lot of women are deficient in is going to be like your alpha lipoic acid, a lot of your B complex, zinc, things like that tend to be very deficient. So I always say to, even if you don't have access to a micronutrient profile, just making sure that the supplements that you're taking have quality micronutrients in them.
You mentioned this IV therapy to go in. I mean, is this what, if we have a naturopathic medicine doctor at our town, can we go and ask for this?
Absolutely. So many naturopathic doctors do IV therapy, which is really cool, because a lot of people have SIBO or a lot of gut issues. And the really cool thing about IV therapy is that it bypasses the gut. So all of those nutrients from an IV go straight into your bloodstream, so your body can immediately utilize it. So if you have an ND, they can literally give you micronutrient support or antioxidant support through an IV.
And then that over time will help with gut health?
Yeah, so
to get back?
there are specific ones for gut health, but if you're trying to improve like sperm or egg quality or just overall wellness, IV therapy is a really, really good option and a very efficient option too.
Birth control versus IUD. What are your thoughts?
So it depends on how you want to use this form of birth control, because IUDs are used for women that know for sure no time soon, or they just had a baby. So they're like, no, I need a break. So IUDs are for more long-term use. And so with IUDs, they come in either a copper IUD, or you can have one that is a progestin hormone. And so these are typically synthetic, but the copper ID, I remember we learned this in our women's health class, the copper ID tends to be the safer option or the healthiest option, because the copper doesn't affect your reproductive hormones as much as a synthetic progesterone, or it's called progestin. And so these are typically for longer term use, whereas birth control, it can either be a combination like progestin and estrogen, or a low dose estrogen. So birth control tends to be more of a temporary option, but women can still take it long term, but you can stop it at any time. Whereas when you have an IUD, sometimes the effects of the IUD can last beyond, when you take it out. So it comes down to, why am I taking the birth control? Do I want it as a long-term option or just something for now?
Is there a time frame on how long that those effects can last post IUD?
It varies per person. Like I know for sure, I was looking online and there were some women that had to wait about 3 to 6 months for their bodies to kind of regain normalcy, because for some people it takes their period away completely. And so it takes time for your body to reverse the effects of those hormones, where some women can take it out and immediately gain, that normalcy. So to me, it's all about the person.
Okay.
For sure.
Is 40 minutes of cardio on an elliptical 5 times a week too much exercise while trying to conceive?
This is actually really hard for a lot of our patients, because when they come in for their fertility treatments, where they just got an IUI or IVF, the doctor tells them to either stop exercise altogether and only do yoga, or to only walk. And some women do CrossFit or, these intense boot camp exercises. And when you do those really expensive fertility treatments, you can't do that anymore, because you're kind of knocking out all the money you're paying. So what the research shows, if you are trying to conceive naturally, is that too much exercise can be damaging to your reproductive health. But my question is, what is too much exercise, right? Like for someone that works out 5 days or 6 days a week for an hour and does CrossFit, that is their normalcy. Whereas somebody who only walks every now and then does CrossFit all of a sudden, that's too much to me. So what it says is that you can maintain your normal routine, because the research is still very conflicting, but you never want to switch up your routine to help you conceive. So if you always do your cardio for 40 minutes a week, don't change what you normally do, stick to your routine. But if you normally just walk, then I wouldn't suggest like switching up to CrossFit all of a sudden. It would be too much.
Well, that is all of the questions I see for now. Thank you so much for spending your Friday afternoon with us.